Hi everyone, I wanted to hop on here and just film part of a conclusion to this strange journey of having a hysterectomy that resulted in injury to my bladder, which resulted in UTI'S for an entire year and strange symptoms such as urine leaking from my vagina for a year and not knowing what to do and where to go. I would love if this reaches you. I would hope that this would give you a little bit of knowledge base and just a kind of a little preparation of what to expect, because we go into surgery, right? It doesn't matter what kind of surgery. You go into that surgery anticipating certain things, and things don't always work out that way. And I think it's better to be informed than shocked in the recovery room. So first and foremost, just in brevis, I had a total abdominal hysterectomy that resulted in injury to the bladder. I pretty much was in the last year trying to get better, but I had recurrent UTI'S. It was a chronic condition, and that also resulted in multiple. It was almost monthly, twice monthly. I was either going to my general practitioner or urgent care for treatment, for antibiotics, and I got to where I would just take whatever they gave me. I thought, you know, at least I could treat this infection and get past it. And I just kept thinking if I could just treat the infection and get better, but it always came back. So if you are interested in any of those videos of like what's it like to go in for a routine total abdominal hysterectomy and wake up with a urinary catheter, if you have strange symptoms after your hysterectomy and you're like, okay, checking in with myself, is this normal? Should I seek out medical attention at this point? What's going on? So I don't know. There's not a lot of information from just real people here on YouTube, and you can probably tell by watching this channel, I am not a YouTuber or professional. I am also not a health professional. I am not a doctor or nurse. I work in nutrition counseling, but am not degreed or certified in any way to give medical advice. This is just firsthand account. What I want to impart upon you is if you do have a hysterectomy surgery scheduled in your future, or if you are considering it, if your doctor has recommended that maybe out of medical necessity that might give you relief of certain symptoms, I want you to be informed of what to expect and also what to do and where to turn if things do go a little bit awry. Basically, first and foremost, talk to your doctor about what your options are as far as the minimal risk during the procedure. There are several options. You have a total abdominal hysterectomy, which mine kind of required because of the size of my uterus and the fibroids. Laparoscopic procedures are typically limited to things that don't require, you know, an enlarged uterus and large uterine fibroids. Because again, small incisions, that just was not an option for me. But you have total abdominal hysterectomies, you have transvaginal hysterectomies, and also laparoscopic. Might be leaving a few out, but again, I'm not a medical professional. I just wanted to run over the three that I was given, the three options. And my doctor kind of explained to me why those other two were not an option. This is important because within each procedure, therein lies certain risks, and injury to the bladder is actually very common. Don't quote me on this, but I want to say 1 in 4 total abdominal hysterectomies results in injury to the bladder because of the nature of where those organs are so close together in the abdomen. I had a very large fibroid that kind of was in the way, and the surgeon was trying to remove my uterus, and my bladder had been stretched to the point that just that slight movement, it tore. That's what I was told. So just firstly understanding the risks, and just kind of knowing what to expect. And also making sure you do have follow-ups with your doctor. I did not, for some reason, the healthcare network that I had my surgery in, I did not have any kind of follow-up visits other than the basic incision check that the surgeon checked my hysterectomy external incision. And I had one more follow-up with him to see if I was clear for the removal or discharge of my urinary catheter. That was it. I had no other follow-ups, and I wasn't quite up for that annual checkup just yet, so I really kind of suffered needlessly, and I did not know. I don't want you to do that. I want you to get a second opinion. I want you to advocate for yourself, because my God, there is not enough advocacy in the healthcare system. Personal opinion. If you are not satisfied with your care, you know, lawyer up and see what your options are, but also get the second opinion of another healthcare provider. Do some research as well. Make sure that when you are going to be having a hysterectomy, make sure that your surgeon is reputable and has had, you know, success in their his or her surgeries, and that they're comfortable and well-versed in that procedure. I am so congested. I'm sorry, I sound terrible. But also, if you are recovering from any one of those types of hysterectomy and you are experiencing unusual symptoms that you cannot account for, if you are leaking urine and you feel like, okay, is this from my bladder? Is this from my vagina? What is going on? I'll tell you, for 6 months of that, I could not tell because I thought maybe what I was experiencing was like pus coming from the vagina because of the surgery, and I just thought I needed to get tough and get better and maybe you know, see a pelvic floor specialist, or maybe I was just overdoing it at work. I really kind of didn't think that the UTI'S and the urine leaking from my vagina were related. They were very strongly related. I learned that I had a vesicovaginal fistula. I've made, I think, 3 or 4 videos now on that, the diagnosis and how that came about. We'll go into detail there. I don't want to bore you to tears, but if you are experiencing any of those symptoms, if you have had just back-to-back UTI'S after a hysterectomy and you're like, there's no, nothing has changed, I'm not doing anything, go back to your doctor. If you're not getting anywhere with the gynecologist because they don't work with the urinary system, I went back to the doctor and I asked, actually, I didn't ask for urology outright. I asked for an infection specialist, because I remember working in hospitals, we had like infection specialist doctors and different things, and I thought, okay, well, clearly I've had an infection for a whole damn year. I think I could maybe be qualified to see a specialist for that. My doctor, who is absolutely brilliant and so caring, I'm very grateful for him, admitted, he said, you know, that's out of my scope. I'm a family doctor. I make referrals when I don't know, and let's get you into urology. And that's where it started. And they put me on the prophylactic, you know, long-term antibiotic dosage. I was on antibiotics off and on for 14 months, and awful. And at one point I messaged my urologist because I didn't have a follow-up with him for several months. It was going to be a 3-month course. I asked him, I said, I don't know if I'm leaking urine from my urethra, or if this is coming from my vagina, but like, do I need to go see my gynecologist earlier than the 1-year checkup? Because I said, I will be standing, and this is embarrassing because my urologists both are like, you know, men, and it's like, this is so embarrassing. But I messaged him, I said, I don't know what this is. And that's another thing I want to talk about is, again, with self-advocacy, ask the uncomfortable questions. I was red in the face. I was so embarrassed. My palms were sweating. This was probably the most humiliating experience to endure with doctors, but I learned something at the ripe age of almost 42. Doctors want to help you. nurse practitioners, nurses, they really, not all of them maybe, but they want to help you. And they are the best way to reach out, because if you don't know, ask. That is probably the most important thing I could pass on to you. If you don't know, ask. I asked him, I actually just messaged him. There's a healthcare portal, and I said, you know, I know I'm going to see you for whatever it was, like December, but it was like that was months away. I said, just while I'm waiting on that, do you feel like I should see a gynecologist? He said, yes, 1000%. He said, that's concerning because that could be what we call a vesicovaginal fistula. That would require a specialist that could work with both. And at that point, that's when he referred me to a urogynecologist, his colleague. And he told me, I'm lucky enough to have a colleague right here, because I messaged him back and I said, so I reached out to the gynecologist and they were scheduling like 3 to 4 months out. Thought, okay, so you know, I'll be waiting to kind of see a doctor at any point for another 3 months or so. He got me right in with his colleague. He is a urogynecologist. He is a specialist in women's, of course, gynecology, but also with urology. And because my unique situation required repair of both, it's just great that he was available. So again, you know, if you're having strange symptoms you cannot account for, if you have to get referrals, ask for them. When I didn't even know, I kind of knew I needed to stop going to urgent care and going to my general practitioner over and over and over again. And I'll do a separate video on this. We're already at almost 12 minutes here, but I was on antibiotics for 14 months off and on, and I'm still getting better. My gut health has suffered greatly. Mental health and everything suffered there. Another video, but advocate for yourself and ask those questions. You know, if you have to see the doctor in person, or if you can message them, if you can call and just say, hey, I don't really know what to do. I have some questions. I have some concerning symptoms that have been persisting. They are not self-resolving. This is all the time I'm having this. Get those referrals. I promise it's so worth it. So worth it. So again, you know, if you find yourself going through a loop like I was with, you know, getting treated with antibiotics over and over and over again, my urologist actually, I don't know if I ever talked about this in the previous videos I did, but he actually called me. I was at work and I saw the number and I knew that was, you know, the urology clinic. When I got the message, it was the urologist, my doctor. I'm like, doctors, I don't think they ever call you. Like, oh my God, is something wrong? He, because I had messaged through the portal again because I was just not doing well. He said, you know, you're healthy, you're young, you have no other major comorbidities, nothing else going on. That's how that referral came about. He said, I can't have you wait for 3 more months to see your gynecologist. I want you to go see my colleague right away. So my God, I'm so grateful for all of this, because I don't know how I would have dealt with it. So again, if you have strange symptoms, if you're having chronic UTIs, if you feel like you're leaking urine, even if it is an incontinence issue, and it mainly is involving just the urinary system, and you could have like a pelvic floor, you know, prolapse. You could have different things there where maybe you could get a referral for a pelvic floor specialist. All of these things, guys, are things that you can get and get referrals to, because after hysterectomy, things are not quite the same, and you might need your little bit of extra care to get your body back to normal. You have had major organs removed and rearranged and cut into and bumped into. Definitely, not to ramble, but you know, get those referrals and ask for that help, because again, that's how it started. I just felt I finally, I think after seeing them and building that rapport and kind of losing that white coat phobia, like, oh, I'm scared of doctors. Dude, don't be afraid of them. Ask them questions. They want to help you. So definitely advocate for yourself. Ask for those referrals. Ask your doctor the uncomfortable questions. And I always go into an appointment with those questions in mind. Like, okay, I've had this symptom, that symptom, and I want to talk to him about it. He knew right away. And it was this aha moment, this breakthrough in the case, so to speak, in almost a whole year of dealing with that. But I hope this video finds you well. I do thank you for your time. I'm trying to keep this quick and short. This is not the last video. I will have a few other videos I want to talk about, again, just recovering the gut health after being on prophylactic antibiotic medication for many, many months or a year like I was. Side note, this vesicovaginal fistula situation apparently results in 1 to 2% of all total abdominal hysterectomy cases. I found that in the most recent statistic through the National Institute of Health. If I do find that article, I want to make sure it is evidence-based and accurate. I will link that down below as well. So again, if you've had strange symptoms, UTI'S, urine leaking from places, you need a urologist or a urogynecologist. They're amazing. So thank you so much for watching and for being here with me today. I do hope for you good health and that you do get better, and take care. See you in the next one.